we have the lights down? Imagine for a moment that you're one of the 15 million pregnant women this year who suffers a complication during childbirth. Imagine that you're poor, you live in a village far from a hospital, and you've been in labor for 2 days, and you know something isn't right. Your family struggles to bring you to the nearest hospital. A midwife greets you at the door, tries to understand why you're bleeding so heavily, tries to determine if your baby is still alive, and tries to locate a doctor who can perform the surgery that will save your life. And that's the only light available. These are the grim conditions that so many women face around the world. And it's part of the reason that women like these in northern Nigeria face a 1 in 13 lifetime chance of dying from complications of childbirth. And they're not dying from rare or exotic diseases. They're actually dying from very common types of conditions that as an obstetrician I've treated for years in this country, but I never associated it with death until I started doing work on maternal mortality in Africa. Part of the problem is that women are poor, they don't have an education, and they are trying to deliver at home without skilled care. But part of the problem lies in the medical institutions themselves, where even when women arrive with complications, they may face many, many barriers to care. In 2008, I joined a research team to try and study emergency obstetric care inside northern Nigerian hospitals. And I'm only going to show you a small sample of what I saw. This is labor and delivery. None of the machines or monitors or bright lights or even privacy that you would expect in an American hospital. But this is where women with complications arrive seeking care. And you're only seeing part of the issue. There's not a reliable electricity source to this state hospital that cares for 150 women every month. And this is what it looks like at night. That's the desk at a maternity ward, and if I flipped on the lights in that room, you'd actually see dozens of patients behind that midwife. Patients that can't get the care they need because the light is too dim. Physicians do surgeries during the daytime when they can rely on the ambient light from the windows. They can't use things like suction machine. There's no blood bank refrigerator because of the lack of reliable electricity. And they can't even use the light that you see there that's supposed to be illuminating the operating field. And there's another issue. Huge delays in care because there's not a reliable communication system. There's no pagers, there's no intercoms, there's not even the power to charge cell phones every single day. So that when people like this woman came in with a condition called placenta previa, she was bleeding, her baby was alive, and she needed an emergency C-section, when a messenger was sent to look for the doctor and returned empty-handed, it was only after I went looking 4 hours later and found a doctor that we got someone who could help, but it was too late and she had lost her baby. That story is a very common type of story that I saw, and what I do is I actually sit inside obstetric wards just watching what happens and sometimes trying to join in and help where I can. And I was pretty upset after I saw the kind of conditions I just shared with you and came home and talked to my husband, who teaches solar electricity. And he and I sat together and thought, well, maybe we could come up with a solution. And we started an organization that's called We Care Solar. And our idea was that we could use a free fuel source, the sun, to bring reliable electricity to medical centers caring for women. My husband designed a system that would work in many wards of the hospital, and I said, can we just bring a small prototype so I can show my colleagues in Nigeria what it is that we're thinking about? And so he devised something that was small enough that I could fit in my suitcase to sneak through customs, actually. And I brought it to my colleagues, and they were really excited. So what does it mean when you have electricity in this situation? It means that nurses can now provide their normal duties throughout the night. It means that midwives can actually assemble a surgical team within seconds or minutes rather than within hours. And it means that surgeries can be performed 24 hours a day. And this is a picture with an LED light bulb that only requires 5 watts of power, yet it's enough to provide illumination for surgery. In this particular hospital, lives were saved, more women were coming to the hospital, less were being turned away, and I thought we actually were done. But some of my friends in the hospital went and told their friends in other clinics, and people started coming to me saying, well, why is it that the hospital has electricity? We do deliveries, and we're in the dark. Can't you help us? And so my husband and I started thinking, well, what if we took that small portable prototype that we started with, and we created something that would be easy for people to use and portable? And so we basically put a small off-grid solar electric system and squeezed it inside a carry-on piece of luggage and brought it to clinics and basically paired it with high-efficiency appliances like LED lights and walkie-talkies. And we brought it to clinics first in Nigeria, where people were really excited to finally have light at night that was reliable. And we found that it was very easy to teach people to use this, and in a few minutes they automatically had power in their own facilities. And then the word spread, and we started getting requests from many places, places we had never been. And soon this little suitcase of ours was going with couriers to countries we'd never been, countries in Africa, in Asia, and then after the earthquake in Haiti, many of them went down to Haiti, where they were being used both in rural areas and then also to provide electricity for medical relief teams in the tents in tent cities. What does it mean to save the life of a woman in childbirth? Certainly it means it gives that woman the chance to live and to get to see her family grow. But in the types of communities in which I work, it means so much more. It means that her baby has a much better chance of surviving infancy. It means that her children are more likely to attend school and less likely to be malnourished, and that her husband is much more likely to stay a productive member of society. In fact, saving the life of a woman is basically helping to ensure that the fabric of a society is continued. And if we can get these solar suitcases into 10,000 clinics and health facilities in the next several years, and if you imagine that each facility sees on average at least 500 mothers and babies every year, it means that we'll be touching the lives of 5 million mothers and babies and their families every year. Now, I've had actually 3 children of my own, and during each of my pregnancies, never once did I worry whether I was going to survive that experience. It never even occurred to me. So why is it, or why should it be, that my counterpart in Nigeria has a 300-fold higher chance of dying in childbirth just because of where she was born? It wasn't until I went to do research in Nigeria, expecting that I was going to come as a clinician and provide some clinical help, that I realized that reliable electricity was part of the problem. And now We Care Solar is trying to provide part of the solution. With a little suitcase that holds a lot of sunshine. Thank you.